It's really unfortunate that my son is one of the TBI patients, but during my last 2.5 years experience in hospitals and the rehabilitation centers, my recommendations or rather suggestions to every parent is please do not lose hopes. There are few mistakes that I have actually done during our treatment. One such mistakes was when he was in the ICU, there was no therapies that used to be done, the rehabilitations and things like that, which has actually caused stiffness in the limbs of my son and foot drops and contractures of wrist and things like that. But one thing that I later noticed when I was in Jain Hospital is any such cases very similar to my son that has come. What I used to understand from the therapist and the dr.sharan and his team is they too, even if they are in the ICU, they used to start this. So please don't lose out on that. Another advice is, financial crunches will certainly be there. If anything such happens to your near and dear ones, don't hesitate. There are a lot of portals which can actually help you for your financial. Identify the right doctors. For me, I've done a lot of study. Post 3 months of his hospitalization. Neuro and Dr. Sharan is one of the best, is what I've found in South India. So I'm on the right track. So hopefully I would also recommend you all to take the right advice, go to the right doctors, go to the right centers, and don't leave no hopes. Hopes is one thing that you always should have. Okay, because from a 0 to 60 to 70% what my son is today, it is only because of the hopes. And if you have hopes, your doctors, your therapists, everybody would support you. And anything happens such to your near and dear ones, please do not keep them in one corner of your house. Bring them to centers, give your efforts. 100% recovery is possible, and my son is an example for you.
So something that we all want, not just me, I'm sure everybody wants us to go international, because the kind of work that we are doing here, I don't think it is that easily available anywhere else. So going international, not just for the growth of the company, but also to help so many other patients who are stuck and who don't know. We've had patients who are like so close, maybe in 1 kilometer distance from us, but don't know that we are doing this kind of work. They've gone to so many places and then they come here after 6 months, after 10 months, when it's more difficult to get them back. So we have to grow so much so that we are able to reach everybody who is in need.
Well, we still believe that this is just the beginning, okay, and there's a lot of ground to be covered in the future.
With all the effort that we put today, I need this word to reach people, educate people basically, that there are services like this available and results are possible.
We don't make any profits. Nobody takes any money home. Whatever little money we make from the higher paying wards is cross subsidized into the economy wards. So it's a Robin Hood sort of model.